Hello and welcome back to GP Video Podcast by Nadia. So today I'm making a very short podcast as my days are going very busy. But as you know, making video podcasts and conveying my knowledge to you guys is very, very important for me. So I don't give up on any chance that I get while driving or while working or while being at home to just make a short video podcast to just give you an important message to remember when you see your GP next or while you're working on your health profile. So today the topic that I'm going to touch base on is high cholesterol and cardiovascular risk. As we know that heart is affected by a condition called metabolic syndrome, which includes high blood pressure, obesity, which is high BMI, high cholesterol, high sugars, fatty liver, high waist to circumference ratio, all of these kinds of things which come under the umbrella of metabolic syndrome, they affect heart very adversely. Whenever you go to your GP for blood test for anything, always make sure that your GP does a complete lipid profile on you, which is a complete cholesterol profile that includes total cholesterol, HDL, LDL, and triglycerides. Just doing one total cholesterol is not enough. They should be doing total cholesterol, HDL, LDL, and triglycerides, because these are the ones that are very, because if we know total cholesterol and it's high, we don't know if it's the HDL part or if it's the LDL part, and what is triglycerides doing, which are more important to know. So yes, please get the entire profile done because that is very, very important. Now, the next question is whether you should be doing them fasting or random. See, you can do it random, but the problem is that if triglycerides come high, we don't know whether it's a chronic triglycerides which is high or whether you've had a large meal and that has caused a high triglyceride. So we'll have to call you back for fasting bloods again. So I think it's a better idea to get them done fasting in the first place. So yes, so always get your complete lipid profile checked. Does not matter if you are a lean person, you are, towards the lower end of BMI, you don't have high blood pressure, you don't have other risk factors. Still, you can have a condition called familial hypercholesterolemia, in which what happens is that your other family members have high cholesterol without any reason, So always make sure whenever you get your bloods tested, get your complete lipid profile. If you're getting them tested once a year or once in 2 years, 3 years, please get them tested for sure. So fasting, complete lipid profile, these two things are very, very important. And then again, the assessment and all depends, will, of course, the GP will do it. But if GP asks you to go on a medication, please consider doing it, because I see patients all the time in my practice and they are too scared to go on medications because they think being on medications means they are unhealthy or the medications are going to have side effects and they are going to be more unhealthier. But no, having high cholesterol is being unhealthy. If you are taking the tablet, you are just trying to remedy it. You are doing good for your health. You're not doing bad for your health. So please get your profile checked, get it fasting, and then if it's high and the GP thinks that you need to be on medication, please go on the medication. Yes, or if the medication gives you side effects like muscular pain is one of the most major side effects. Yes, if that is happening, of course, we can change the dose, we can change the medication. But apart from that, if you haven't had any side effects and you just think that, oh, I'm on this medication for no reason, no, that's not true. You are on it for a very good reason. And if the next blood test even indicate that your cholesterol levels are down, that's not a problem. Low cholesterol is not a problem, especially if you are on a medication. So please do not worry about that. See, cholesterol tablets could be for indefinite period, so don't worry about that, especially if high cholesterol runs in the family. High triglycerides and high LDL, these two cholesterols, bad cholesterols, are very, very important. If they are high, we really need to treat them. So that was the short message for today.